Taiwan added a little over 66,000 local COVID cases on Tuesday. Authorities said that on the whole, Taiwan was moving past the peak of Omicron wave, with cases trending downward in the northern and central regions.
Although infections remain rampant in the south, the CECC expects case counts to decline in another week.
Familiar figures take their seats at the CECC's daily press conference. CECC head Chen Shih-chung is conspicuously absent due to a COVID infection. His role filled by second-in-command Chen Tsung-yen. Spokesman Chuang Jen-hsiang was also absent, his place filled by Social and Family Affairs Director Hui-chuan. Two other officials were missing from the press event on Tuesday. CECC Medical Response Division Deputy Head Victor Wang and Head of the Center's Community Infection Division Hsueh Jui-yuan also tested positive for COVID-19.
Deputy Commander Chen Tsung-yen and I will handle today's press conference.
The CECC announced 66,119 new cases, fewer than on the same day a week ago. The CECC says Taiwan is slowly passing the peak of infections.
In northern and central Taiwan, it is more obvious they are already past the peak. In central Taiwan, there is already a downward trend in the number of cases. It's patients in the south who are occupying many of the hospital beds. The south is likely approaching the peak. We estimate that in a week or so, the numbers will trend downward.
With cases of BA4 and BA5 already recorded in Taiwan, the CECC says it's a matter of time before cases appear in the community.
Local infections with BA4 and BA5 are inevitable because our quarantine policy is not designed to block out all cases. Whether we're talking the 7+7 policy or the 3+4 policy that takes effect tomorrow, there is bound to be some possibility of people bringing the variants into the community.
Health experts say that a fourth dose of an existing COVID vaccine or a shot of a next-generation vaccine will be necessary to stave off infections with the subvariants. The government has already purchased 10 million doses of Moderna's next-gen vaccine, which is awaiting emergency use authorization.